What is up, y'all? This is Not a Real Doc DPT, and welcome back to the channel. Today, we're going to be talking about kind of an extenuation of the last few video series that I did, which were on the expectations that you could expect for your physical therapy in a variety of different settings. And it came to mind that one thing that I wasn't sure that patients maybe understood or had an idea about is what is actually good physical therapy. So I came up with basically like a kind of a top 10 list of what are some good examples, what are 10 good examples of um, physical therapy, like good physical therapy. And actually, I came up with more, and I was trying to come up with 10, and I actually came up with 12. So this is a top 10 plus two. So under promising and over delivering. um, so physical therapy, when it is being applied best, I would say, is really as much an art as it is a science. So you go to school, you learn all these different techniques, you learn how to diagnose all these different things, and then from that basis, you're then trying to apply what you've learned to all the different patient types that you might come across in all the different settings. And that's really when physical therapy becomes an actual art. So then it's the art of applying the right treatment at the right time for the right patient with the right condition to help progress them and get them better. So I definitely think that is a kind of a key to the backbone for what makes good physical therapy and that's going to be a person that is understanding that in their practice, and that's how they're kind of conducting themselves with that in mind. So within that, the first thing that I believe that I thought of as far as good physical therapy, that is going to be a, a physical therapist that is attentive to the patient and trying to help that patient achieve their goals. Not necessarily our goals, but what does the patient want to get out of this? What is the patient trying to return to? So it is paying very close attention to, what is it that you're trying to help the patient with, and making sure that you're on the same page with the patient. Because it would be easy to be, for a patient to come in and be talking about, their the difficulty or their pain they're having in their back. And so you've kind of focused on that, but then they may also mention how they have had balance issues, and their pain in their back is from some of the falls. And then if you're just treating the pain in the back, but you are not attentive, and then actually addressing their balance issues and treating that balance also, then you may miss kind of what the patient is going for. So number one is good physical therapy is being done by someone that has that is attentive to the wants and the goals that the patient has for their health care, and for what they're coming in to see you for. Number two, so this kind of builds on this. This is almost what is an example of bad physical therapy, but one thing that I thought was a very specific example is good physical therapists and good physical therapy, they do not have their phones out, and they are not talking on their phones. They are not texting on their phones. Also, in addition, they do not have their heads buried in their tablets or their laptops working on their notes. They are actually communicating and are staying in tune with what the patient is doing. They are on top of and noticing everything that is happening with that patient, and are analyzing that and assessing that at all times. They're not distracted with things like cell phones or things like their notes. Now, that's not to say that we're not going to be multitasking and actually doing some notes while we're working with patients and going back and forth. But you can do that, and you can work on different things at the same time, but still stay attentive with the patient as well. So that's a good physical therapist is not pulling their phone out. All right, I'm having tons of trouble with my stupid webcam here, so like it keeps shutting off while I'm recording. So there may be edits and I may have to just merge this together if this keeps doing this. So I'm trying to do it. I'd like to do it all in one cut, but I'm probably not going to be able to do that this time. So bear with me as there are breaks here. So all right. So on to number four. The I'm sorry. On to number three. So the physical therapist that's doing good physical therapy, they're going to take objective measurements on maybe not necessarily every single visit, but on certainly on the very first visit, and then they will follow that up. If not every visit, at least every other visit. They don't necessarily have to measure everything. They don't have to test everything, but they should be following up on what those objective measures that were taken at the eval over time as you're working with them. Because otherwise, how do you know that you're making progress if you're not actually going back to the objective measurements that the therapist was taking? So I think good physical therapy involves actually following up on the objective measures that you're taking and coming back to it. So you have a knee replacement. We're going to keep coming back to measuring your knee and seeing what your range of motion is going to be and seeing how well you're progressing along. Maybe not every single visit, but at least about every other visit, I would say is a good kind of best practice. So number four, okay, this is a big one. So good physical therapy is going to be as close to one-on-one as it can be. So now, if patients are Medicare patients, they're by law you have to be one-on-one with those patients. So that kind of solves it with that. But what oftentimes happens in the outpatient setting, then they will then when patients that are not Medicare patients come in, they'll overload the therapist with patients that are like private insurance patients. So you may have multiple Blue Cross patients at the same time. Now, you can do that. A good therapist and a seasoned therapist can work with more than one patient at the same time, and we can make sure that each patient is feeling that they are receiving one-on-one individualized care. It just is a lot harder to do, especially the more patients that you add into the mix. So you want to get as close to the ideal of one-on-one as you can. However, also another reason that outpatients don't do that with all patients is that one-on-one, you just don't have all the reimbursement there to do that. There are facilities that try to do that, but you just don't get reimbursed enough to keep a clinic open like that. So you do have to have the ability to multitask and work with multiple patients at the same time. But there's a threshold to that. I would say 2 patients is certainly okay. 3 you can do, but it's starting to get a little dicey at that point. If you're working with more than 3, any therapist that is doing that, it is very difficult to stay attuned to what is going on if you've got 4 or 5 patients. That's when I used to tell patients, hey, look, occasionally that would happen if somebody's coming in early and somebody was late, and then you wind up having this overlap where you're working with 4 or 5 patients at a time. And that's when that's when patients, they know now that their therapist is being overworked, and that's never a good thing. That's when you're kind of letting the patient start to see behind the curtain, so to speak, and they see you stressing, and that's not good. So I would say good physical therapy will be as close to the one-on-one model as it can be, but understanding that being one-on-one with all patients just doesn't work because you just don't get the reimbursements to be able to stay as a clinic. Like, you just don't make enough money doing that. But you can certainly do that with 2 patients. That's absolutely workable. Even 3 is actually a kind of, I would say, almost an ideal at times. So that's a good physical therapist, is patients that are that kind of have all that in mind. So that's number 4. Number 5. So this is, I think, also another good one. This is good physical therapy is being done by someone or by clinicians that understand the modes of intensity that a patient is working within, and keeps them within a good range for them to make progress. They're not just overloading the patient all the time. They're not making the patient work too hard, but then they're also not doing something too easy. They're understanding how much can you push that patient, and they're pushing them just enough for them to make the maximum amount of progress that they can. That is a skill that therapists develop over time. It's not something that you just have. But again, if you go back to that number one recommendation, or number one item that made good physical therapy, was being attentive to the patient. If a therapist is very attentive to their patient, then it's easy to understand where or how hard a patient is working, or how, let's say, your manual therapy that you might be doing, how hard that patient is, or how is that patient feeling what it is that you're doing with them. So understanding the intensity and how that affects the patient is a really important one. So the number 6 thing that leads to good physical therapy is, again, kind of building on what I've kind of just said, but that's going to be appreciating how hard a patient is actually working. So they're not just applying that intensity themselves to the patient, but then they're also like watching what the patient is doing. They're assessing and can see when a patient is working too hard, and they're able to kind of pull them back from that. So having a good assessment of when of how hard they're working is a really important thing. Excuse me. Number 7. This is a patient that a physical therapist that communicates well and is able to encourage and motivate the patient to actually do their physical therapy. I would say also that communicates in a way that is that where the patient understands why it is that we're doing this. They have a good understanding for what their injury was, why they're having the difficulty that they're now having, and then how they can be led out of that situation. So a good physical therapist, I think, teaches their patients about all of that, and then communicates that well to them, so they have a good understanding of what it is that we're doing, why it is that we're doing it, and can then progress them along. So that's number 7. Number 8, and it's hard. I put an asterisk beside this because I'm going to be coming back in a future video series on this topic, because unbelievably, I can't believe that this has actually become a controversy a little bit. But I would say, for all physical therapy, well, I'm not going to say all, for the majority of patients that seek physical therapy care for dysfunctions in their movement, they have pain with movement. The two tools and the best tools or toolboxes that therapist is going to be able to use with you to help you grow out of this condition is going to involve exercise and then manual therapy of some sort. Now, there are all sorts of manual therapies out there, and somehow it's become controversial in the last few years as to whether or not patients are actually benefiting from manual therapy. I really can't believe that that's even a discussion point. It's just after having practiced with thousands of patients myself, I can say anecdotally anyway, absolutely manual therapy is beneficial. Absolutely, manual therapy is critical for a host of patients. It's not going to be across the board. There are some patient types that you might not do manual therapy with. Like, let's say you have an older adult who comes in and they just have had some balance issues, and you're kind of working with them to prevent their falls. Or let's say you might be in the home health setting, working with that type of a patient. That patient may not get very much manual therapy. Okay, so it's not necessarily across the board, but for anyone that is having pain with movement, good therapy is going to involve manual therapy. It's not going to be the only thing. So we're not chiropractors. We're not only working on manual therapy work. We're going to, but what the manual therapy can do is to help joints move better, can help fibrosis kind of break up a little bit more. You can help scar tissue. You can remodel scar tissue so that then joints can move better. And then we can do those exercises, do those stabilization things that are then going to help you continue to grow out of it. So, without a doubt, good physical therapy for the vast majority of patients, especially in the outpatient setting, is going to involve some sort of manual therapy. I tell patients a lot of times, if the therapist you're working with, an outpatient, doesn't put their hands on you in some form or fashion. Now, as I say, we'll do their manual therapy can encompass a whole host of different things, and so I'll just leave it with that they are touching you somehow and delivering some sort of manual care to you. And that can involve dry needling as well. I considered, some people will say dry needling is a modality. I think it's more of a manual therapy myself. But the anything where they're actually touching you, that is good physical therapy. All right. So number 9. So we're this is going to be a good physical therapy. Is going to involve a doctor of physical therapy that is observant to every patient that they're working with, and they are correcting you if you're doing it wrong. I have seen this in certainly, well, I've seen this in gyms, I've seen this in clinics. In my clinics, I have would correct this if I saw it with another therapist being done or something, but I've seen where patients may be doing something, but they're doing the form wrong, and the therapist doesn't correct them on it. That's not good. You're a good physical therapist is going to be watching everything you're doing, and I might be doing manual therapy with a patient over here, but I've got my eye on you at the other table. What it is that you're doing? If I see that you're doing it wrong, I'm going to say something about it. If that doesn't correct it, then I'm going to stop my manual therapy. I'm going to go over and correct you, show you how to do what it is that you're doing wrong, and then come back to the manual therapy. And you can do that if you go back to some of my earlier points about communication and being attentive to the patient. You can do that with both patients at the same time, and both still feel like they are both being cared for and getting the appropriate care for their needs if you do that right. But you can't let patients sit there and do something wrong, like using poor form or not going through a full range of motion with an exercise or something like that. You have to correct that. So that's good physical therapy where they're going to do that. All right. And number 10, we're on to number 10 here. One thing, and this, I don't know if I would say also, in addition to understanding the patient goals, one thing that we should have mentioned is the goals of the physician. So especially when you're talking about orthopedic patients and surgeons will have parameters that they're trying to get you to hit as far as range of motion goals and things like, let's say, for a knee replacement or what have you. So it should be noted, because for all of these patients, and except for those that are able to come for direct or come with direct care and physical therapy, most all patients have gotten a referral from their physician. So we do want to include the physician in this mix, and good physical therapy is going to pay attention to what it is, not just what the patient is wanting and not just what you're as the therapist are wanting, but what is that physician requesting you to do as well. You want to include them in those goals. You want to get back with them. You do want to update them on how things are going. If there's a problem, you certainly want to be attentive to them. So a good physical therapist is certainly going to have good and open communication with their colleagues over on the medical side, and keeping them attuned, because they're also the reason that you're there as a patient. All right, so that was 10, but as I said, I underpromised and over-delivered, so I came up with a couple of more things. So this one, well, this is an obvious one, I would say, but a good physical therapist, it should also be stated, follows evidence-based medicine and best practices in their care of patients. We kind of have discussed what that sort of is as far as best practices and kind of touched on some of that. But evidence-based medicine, that's considered to be it's basically a kind of breaking up medicine into three, or healthcare and healthcare delivery into three different things. One is going to be research based, so that's about a third of what's out there. A third of evidence based medicine is going to be what you, as the treating clinician, have experience with and know to be beneficial to the patient. And then the third part of practicing evidence based medicine will be following the patient goals and doing what the patient thinks is beneficial to them. So all three of those things come together to form what is called evidence-based medicine, and that is what a good physical therapist is going to follow in their practice. All right, and the 12th thing that I came up with here, and this is going to be the uh, well, I've kind of already touched on this, but I'm gonna come back, and I thought it was sufficient enough that I should actually make this as a its own uh, number. So number 12 out of the top or 10 things I could think of that would make good physical therapy practice. Number 12 is a good physical therapist. It is critical that they know how to multitask. Multitasking, you have to be able to uh, be working with one patient, but then have eyes in the back of your head and understanding and knowing what the patient is doing behind you. Ideally, I always like to have set up where I'm working with a patient here, but then I've got out of the corner of my eye, I can see what my other patient is doing, and then I can go back and forth between those two different patients. And you've got to be able to multitask. You also, that includes the communication aspect, and I think that's what a lot of times sometimes that gets mixed or missed. But if I'm working with two patients or even three patients, I don't want to just focus on one patient and then leave the other two out when it comes to any discussion topics or anything like that. You want to include all people that you're working with into any conversations that come up. Like if I'm doing manual therapy with a patient, especially if the manual therapy, like I do a lot of myofascial work, and that can be kind of painful for a patient to experience. So one thing that I like to do is kind of get that person talking, get them talking about something different, so that way I can kind of put their mind over to one side, so they're thinking about this while then I'm over here doing the treatments that I need to do to help them get better. So then what can help with that is then you get that person talking about their particular topic, and then you look over to the patient that you're also working with, maybe giving them exercises to do while you're doing manual therapy with this patient. And now you include, hey, what are they talking about? Well, you ask this person, hey, what has, what do you know about what this particular patient just talked about? And you rope a good physical therapist, I think, is going to rope the all patients together into a communication. And so then they actually are kind of collectively having an experience together. Oftentimes, as therapists, we develop friendships with our patients. A lot of times, I've had where patients are not wanting to be discharged because they have fun when they come to our clinic and work, and so they kind of like the camaraderie and the joking around. I do joke around a lot and stuff with patients. I think you kind of have to do that if you're doing things that might put them in a little bit of pain. It's helpful if you can make them laugh while that's happening, so that you can help them to get better. So anyway, those are the 12 things that I kind of came up with when I was thinking about what I wanted to impart to you about what makes good physical therapy. So it's the top 10 plus two that I was able to come up with. And from this has led me to think that a good video topic also would be, what is bad physical therapy? So it's kind of obvious that it would be just the obvious or just the opposite of what is considered good physical therapy. But I thought that might make a good enough video topic that we're going to do that, or I'm going to do that for the next video. So I hope that you have enjoyed this video and that you've learned a little bit of it, or a little bit of something about physical therapy out of this and what you should be looking for good physical therapy. And if you think this is and this has been beneficial to you, then please hit the like button, subscribe if you can. This is a new channel that I'm trying to get going and get growing. So any help like that would be appreciated. So all right, so be on the lookout now then for the next video's topic, which is going to be what is bad physical therapy. All right, y'all have a good one. Bye.